Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today we're chatting with Anae and Andrew Armitage from the Greenside Referrals in the UK, and they're chatting about the musculoskeletal side effects of Librela. Now, Librela has transformed pain management for many dogs living with osteoarthritis, and for the vast majority of patients, it has provided significant improvements in their comfort, their mobility, and their quality of life. However, like any medication, it's important that we continue to learn both about its benefits and its potential risks as more dogs are treated over time. Now, in Andrew's clinical experience, he has noticed two patterns of bony change. The first one is rapidly progressive joint destruction, which can occur within two treatments, and then also insidious periarticular mineralization syndrome. Now, this is a condition that tends to develop over a longer treatment period, and he's seeing two different types of presentations. One is like a popcorn mineralization, and the other one he calls Stegosaurus exostosis. This episode was originally recorded as a Facebook Live, where Andrew shared radiographs and a detailed presentation. So as this is an audio-only podcast, those visuals have been removed, so you'll hear the discussion, the clinical insights, and questions from the vet rehab community. Now, if you'd like to view the radiographs and complete presentation, the full recording is available in the Onlinepethealth Members Library. So whether you prescribe Librela, work closely with osteoarthritis patients, or simply want to stay informed about emerging clinical observations, this episode offers some really valuable insights into an important and evolving topic. So before we head over to that chat, some news about the Vet Rehab Summit. The website is now live. You can go to vetrehabsummit.com to find out what we've planned. This year is an extra special one because we're celebrating the 10th Vet Rehab Summit, and our theme is the brain. We'll be diving into the incredible role the brain plays in movement, pain, learning, recovery, performance, behavior, and rehabilitation. And it's a really fascinating topic that influences every patient we treat. And we've brought together experts from all around the world to share the latest science alongside practical strategies that you can use in your clinic every day. So the summit is completely free to attend. So if you're a veterinarian, vet nurse, physiotherapist, hydrotherapist, or rehabilitation therapist, now's the perfect time to reserve your place. You just have to be live. So go to vetrehabsummit.com, find out all the information, and sign up to get notified. We're also excited to welcome Curacao as our gold sponsor again this year. Thank you, Curacao, for your support. A quick word from our sponsors. Support, prevent, and rehabilitate. That's the Paw Prosper way. We'll build a portfolio of industry-leading brands like Walking Pets, Help 'em Up, Spawned Animal Therapeutics, Fit Paws, and Blue Nine to give your patients the gold standard in care. And we have some big news. Paw Prosper is officially the new home of the Canine Rehabilitation Institute and Onlinepethealth. We're bringing the best products and the best online education together under one roof to help you and your patients thrive. So as a special hello to the Onlinepethealth community, we're offering a one-time gift with your next order when you sign up today. You can head over to pawprosper.com/OPH and join the movement in pet rehabilitation.
Hi guys, and welcome. Hi, Dr. Andy. Thank you so much for joining us today.
Hi there.
Okay, so Dr. Andy is from Greenside Regenerative Therapies and Rehabilitation in the UK. And before we kind of get into it, can you please introduce yourself and share a little bit about the journey that brought you to this topic of adverse events associated with Librela use, and why that is what you want to discuss with us today?
Okay, for sure. So, I'm Andy. I work at Greenside Referrals based in the Scottish Borders, where we deal with a lot of musculoskeletal conditions. So we do a lot of treatments with regenerative medicine and orthobiologics, and a lot of rehabilitation as well. So we're a referral practice, and we have on-site physiotherapy and hydrotherapy as well. And we've got a team of 3 vets here. And yeah, pretty much 100% of our time we're dealing with musculoskeletal conditions. We were the first referral center to open up in regenerative medicine, and we did that about 13 years ago. So we've been using stem cell therapy and PRP treatments for a long time now, and have a lot of experience. And I guess this is how I ended up becoming interested in Librela as a treatment option. And I guess historically, we see a lot of patients with end stage arthritis because we tend to be the referrals tend to be owner led, and we see a lot of end stage disease. So a lot of our patients are coming to us as a last resort. So they've had the drug therapy, they've had the rehab, they may have had surgery, and they're still not improving. So the owners explore different options for treatment, come across stem cells, and then come across us, and then come to see us for help and treatment. So I would really like to be involved in early disease process, at the time of diagnosis, but it's just the way it is. We tend to be used as a last resort, and we can get some fantastic responses. So we do tend to see the worst of the worst, and we get referrals from all over the UK, as well as from Europe as well. So we see animals from a very wide area. So about 3 or 4 years ago, I started seeing a shift in findings when we started examining these dogs. And I guess a lot of my work is Labradors, and a lot of my work is elbow dysplasia and advanced arthritis associated with elbow dysplasia, and that accounts for probably 70% of my caseload. So we started to see cases that were really struggling, and when we come to do the diagnostic, so take x-rays, we were seeing some really severe arthritis, and this started happening all of a sudden. So I saw one case, and you take the x-rays and you're like, gosh, this is severe. And then the next week I saw another case, take x-rays, you're like, what's going on here? And all of a sudden I started thinking, this isn't arthritis that I'm seeing. This is, and I've seen some pretty end stage arthritis joints just because of our caseload, but there was things on the x-rays that, cancer comes to mind, other conditions. There was all this bony proliferation, and then it just kept going, and I kept seeing case after case after case of all these radiographic abnormalities, and patients really struggling. And the common theme was these patients had been given Librela. In most cases, they had improved on the Librela and then started to deteriorate again. And hence that's why they came to see me. And then we're x-raying and seeing these abnormal x-rays. So that led me to start reporting these cases to Zoetis and the VMD. And I felt that it wasn't being recognized in primary care practice as a problem. Mike Farrell's paper that was published a few years ago now certainly raised a lot of awareness, and I did a poster presentation at the Veterinary Osteoarthritis Alliance conference in 2025, where we showed these x-rays and we tried to sort of classify what we were seeing, and so to raise awareness. And it was at that conference, and because of my poster presentation, that Zoetis were there, and so were the VMD actually, and both of them were very interested in this. And Zoetis asked me to publish this, which it's taken me some time, but I have recently published a paper on the identification and possible pathogenesis of Librela-induced adverse events, and that was published in April in Companion Journal. So that's how I've sort of become involved in this. And some weeks we're seeing 3 cases a week of this, so it's something that we're seeing a lot of. And I guess it's because of the work that we do. These cases are sort of funneled to us because it's the worst of the worst, so we're getting an over-representation. Certainly speaking to primary care vets, they are not seeing it as frequently or not aware of it. So my goal is to raise awareness.
Okay. So
Sorry,
to everyone
that was
that's
a
joined
long
us live, no,
introduction.
it's very good. Thank you. So I already have comments coming through. Hi guys, it's so good to have you with us. So my first question is, I have never seen radiographs like this associated with anything else. Is that right? Are there other conditions where we're going to see bony changes like this, or are these changes really specific to Librela use?
So yeah, I mean that's I think they are pretty specific, and that's why when I first started seeing this, you initially think, oh, that's terrible arthritis, and then you're like, no, that's not arthritis. It doesn't look like that. And certainly for this Stegosaurus exostosis, I'm not seeing that in any other condition. These popcorn lesions, as I say, I've seen one case of actual chondrosseous metaplasia, and that was in a flat coat retriever many years ago in its stifle, and it was associated with early cruciate disease, and it developed that. But that's one case. So yeah, it potentially can occur as a naturally occurring pathology, but it's not common. And mineralizing enthesiopathies and tendinopathies, yes, it can occur, but it's normally one tendon. So we see a lot of supraspinatus enthesiopathy, which is mineralized, but Librela doesn't seem to do that to the supraspinatus, but it does do it where there's potential instability in an elbow, and we get all this collateral ligament damage and mineralization and things. So yeah, and I think that's the whole point of my paper, is that these are new findings, and it is rarely seen in a normal arthritic joint. You start to question bone cancer, but that doesn't cross a joint. There's a condition called Mary's disease, hypertrophic osteopathy, where if you have a mass in the chest, it can result in bony proliferation. On the diaphysis of the bone, and but it doesn't really look like that either. So I think to me it's quite classic signs, and I would say I can look at an X-ray without looking at the dog or having any history and tell you whether that dog has received Librela or not. That's how confident I am.
Oh, okay. Let's pull up some of these questions. So Helena asks, do these changes only occur in the joints that originally had the osteoarthritis?
No. So I think it occurs in joints that have pathology, but that pathology may not have been, it may have been clinically silent. So, you know, I've seen dogs that have had elbow issues, started on Librela, and you know, no other musculoskeletal condition was diagnosed at the time. And then, yeah, 6-12 months later, it's hocks collapse, swell up and collapse. And so yes, we can see it in what's called off-target joint. So where we're treating osteoarthritis in one joint and it can occur in the other. I see it very commonly in that scenario in the digits, hocks and carpi, most commonly. And yeah, certainly in I feel like there's got to be some, that joint wasn't perfectly normal, so it may have had some early instability or early arthritis, and then the Librela makes that worse, but it wasn't clinically there, because, you know, we're not getting a dog with elbow adverse events and then every single joint in its body is affected. It's strange in that respect.
Okay, cool. From Carol Ann, are older dogs more likely to experience these side effects, or does it affect all ages equally?
It affects all ages equally. I see it in, you know, young dogs and old dogs. It's seems to be the time on that they've been receiving Librela, not their actual age.
Okay. Are you aware of any independent reports on the bone and joint findings from the necropsy reports on the laboratory beagles?
Is that referring to the initial studies done for authorization? Because the initial trials of Bedinvetmab was done on young beagles, and they did do so I think there was histopathology done on the joints in these dogs, but they'd only been treated with Librela for 6 months, I think, and there was some questionable pathology on 1 or 2 of the dogs involved in that study, but it was dismissed, I think, as a problem. So certainly I'm starting to do histopathology on these cases myself. That one that shows you where we removed those pebbles from the joint, you know, sent that away for histopathology. I've got another case that had severe elbow problems, and as a result of elbow dysplasia, he had advanced arthritis, was started on Librela, and his whole elbows just calcified, and then he was walking down the road and his elbow just fractured, just walking on the lead, nothing traumatic, just collapsed, and his elbow intra-articular fracture through the ulna, and I could not find an orthopedic surgeon that would repair it. So we sent the radiographs to four surgeons to see how they would repair it, and the changes in the bone were so severe that they didn't recommend surgery. Amputation was an option, but the owner, well, I wouldn't have done that because the other elbow was just as bad, and I think that would have fractured itself. So we treated that dog conservatively, and he did well, actually. The joint actually fused eventually, but the owner wanted me to send his elbows away for histopathology when when he was no longer with us, and that happened a few months ago. We put him to sleep because we couldn't control his pain, and we sent the both elbows, the entire joints, off for analysis. So that was nearly 3 months ago, and what I can tell you is that they're only just able to start processing and looking at the soft tissues associated with the elbows, because it's taken over 2 months to decalcify those tissues. So when you're looking for histopathology, I want to know what's going on in the tendons, in the joint, and things like that. But you have to take away the bone, the calcium. So you decalcify the tissues, and that normally takes 1 to 2 weeks, maybe 3 weeks to dissolve a whole bone, so that you can do histopathology on it. And this case, and the histopathologist hasn't seen anything like this, and it's just like 2 months it's been decalcifying, and we're still not fully there. So that just shows you the amount of mineralization that was occurring in and around that joint and all the soft tissues. So I'm waiting on the histopath for that. I think that'd be quite interesting. I don't know whether that answers the question.
I think it does. Denise does say yes, the Beagle study. So
Yes.
I think you were on the right one there. Jane is keen to know if you're seeing the same problems with cats on Silencia.
So I am not, because unfortunately we don't see many cats. We have treated a few. I'd love to treat more cats. We just don't get them referred to us. But I've been in communication with a lot of orthopedic surgeons in America now, and we're working together on several publications. And yes, I've seen some X-rays from cats that have been on Silencia and seen hocks that look very similar to the dogs, with a severe soft tissue swelling with this Stegosaurus exostosis and hock collapse. So yes, it is being seen. Me personally, no, but other orthopedic surgeons are, for sure.
Okay, so Debbie is asking about the human version, and that's a question that I had as well. Is, can you kind of take us through how was this drug rejected for humans and then approved for animal use? How did that work? And is that a failure of the system? How could that be possible, that it's rejected for use in humans and then approved for use in animals?
That's a very good question, and a question that I ask as well. So for human drugs, there is a lot more rigorous process. So it's a bit more lenient in animals. So the human anti-NGF antibody treatment, as I say, was causing rapidly progressive arthritis in a proportion of cases. They found that if it was given in combination with non-steroidals, that was maybe a risk factor, but it was also seen in patients that weren't receiving non-steroidals, and that's why it didn't get through the phase 3 trials. And they found that the incidence of joint replacement went up dramatically on patients that had received the human form. So that should give you information that you would want to investigate if you was going to do this in another species. And I think when it was tested in rats and rabbits as well, there's some studies that show, yes, similar changes where we get joint destruction. There was a rabbit study with cruciate transection to stimulate arthritis, and certainly in rodents as well. So it would be common sense to think, yes, we should expect this. And then it went through market authorization in the veterinary field, and there was the study was looking at young healthy beagles. I forget how many there were, but they were only monitored for 6 months of treatment. So I think that is with the licensing of veterinary medicines, it is a bit more lenient than the human side, but that's not my area of expertise. But if I was developing this, I would look at what was happening in other species and maybe design my experiments a bit better to ensure that it wasn't going to happen in our target species.
Because one of the issues has been that these, as you say, these side effects are not necessarily unexpected from the data that we have. But what happened is the drug was released and brought into the market, and primary care veterinarians were not educated on proper screening, the risks of side effects. They had no idea, and they were just giving this miracle drug without monitoring the patients, without being aware of what could go wrong. I think that is concerning.
We at Greenside, as a practice, we were one of the early users of Librela, and when I first started using it, I was like, this is brilliant. Great pain relief, reportedly no side effects, particularly for these dogs that are sensitive to non-steroidals and things like that. I was like, this is brilliant. But then very quickly, these dogs were coming back with big swollen elbows, but the owner's like, they're doing great, and I'm like, but why have we got a joint effusion? They're drinking a lot, they're urinating a lot, and becoming incontinent, and then they start getting wobbly, and then all these other things, behavioral change, things I started noticing, and then we start seeing the more insidious joint changes. So I think it was, now the drug is being used, and it is being used widely. We're seeing this, and I think in America it's becoming more and more recognized, because they were a year behind the UK. So they're just starting to wake up to the fact that they're seeing a lot of adverse events now, a bit delayed from us because we had it a year earlier to them.
Okay. So I very much appreciate that you kind of started this conversation by highlighting your case bias, right? Patients with end-stage osteoarthritis are coming to you. The patients that have been on Librela for a long time and then are having these really severe adverse events, they're the ones that are coming to you. So those are the cases that you're seeing. I appreciate that you shared that. I do want to highlight, I kind of went through our professional community before this discussion to just see what others have been saying. And there are many other side effects, right? We're not just looking at the joint, the strange development of metaplasia in the joints. We're also seeing restlessness, changes in sleep, urinary incontinence, dogs that feel so good that all of a sudden they do something ridiculous and then hurt themselves in another area. That's a super common thing that's happening. Neurological deterioration is another very big concern that comes up. Are there other things that you're aware of, other adverse events that we should also be aware of and thinking of?
I mean, I'm probably not the best one to answer that, because as I say, it's mainly musculoskeletal problems that I'm seeing. But certainly cognitive decline and behavioral change. I've had dogs with weird noise phobias, aversion to metal food bowls. What's going on there? So the dog refused to eat, Labrador, refused to eat from a metal food bowl. Give it a plastic or a ceramic one, no problem. And that was started after Librela, and resolved when we discontinued the Librela. So in theory, it shouldn't cross the blood-brain barrier. It shouldn't cause any problems within the central nervous system, but it does. And I see dogs that get very depressed on it, and that reverses after the Librela has been discontinued. So the main things that I see and reported is increased thirst, urination, incontinence, ataxia, neurological, like they present almost like an invertible disc protrusion, but may not have proprioceptive deficits, weird behavioral change, restlessness, as you say, lack of efficacy. That is the most commonly reported adverse event, that is lack of efficacy. And why is that? Is it because you're causing other problems, and that's why it's not working? So yeah, there's a whole, and if you look at the Librela Experiences Facebook group, there's thousands of people on there reporting all sorts of potential problems. It's difficult because, especially in older dogs where you've got a lot of comorbidities, it's difficult to say, was it definitely Librela that caused that, or would it have happened anyway? It's very difficult to pick that apart, but certainly there seems to be a common theme, going through these. Seizures is another one,
Okay. Okay. So my next, I think we should start to bring this together. And we do have a few questions here about screening and kind of best practice in use. So instead of pulling those up onto the screen, can you share with us what is the screening process we should, or veterinarians should be going through before using Librela, and what is kind of best practice right now to avoid these adverse events, if we can?
I mean, that is very difficult. What is best practice? I mean, we need more information, and we need to know the true incidence of this. We need to know what predisposing factors there are, to be able to guide us. I think certainly before, I mean, I haven't given an injection of Librela in over 2 years myself because of my concerns. But I think, yeah, certainly informed consent. So we need to be discussing this with the owner and advising them that there is potential side effects, and we don't know the probability of that, and we don't know which situations we should or should not use it in yet. So it's very difficult, and until we know that, it is very difficult to advise. So I think it's very important to, before we start using Librela, is we use it for arthritis. So we need to have that diagnosis confirmed, and I think we need to have at least radiographs to diagnose that, rule out other conditions, rule out neurological conditions, because we've got the potential of making that worse. Some people say, oh, we should reserve it for the older dog, don't use it in younger dogs, but the older dogs have got comorbidities and more likely to have adverse events. So I don't necessarily agree with that. Shouldn't use it in younger dogs, some people say. But there are some dogs that respond very, very well to it, and they can't tolerate other drugs or non-steroidals, and this may be the only option for them. But it's just not knowing the probability of problems. And we're only going to know that through more research and collecting data and reporting. And that's why we need to make everybody aware of the potential problems, and if they see that, to report it, so that we can get a better, more generalized picture. I was speaking at a conference last week, and I touched on, I showed that presentation that I've showed here, but before I started that, there was about 100 primary care veterinary surgeons in that conference, and I asked for a show of hands. I said, who has got concerns about adverse events related to Librela? And I guess about 10 people, 10% of that audience raised their hands and said that they had concerns. So there's a lot of, and there's vets that I talk to that say, I've never seen a problem, never seen a problem. So yeah, my population of animals is skewed, but it's still significant.
Yeah, this is the tricky area now, is that, that percentage of dogs that do really well on this drug, that it is the only thing that's making a difference for them. Do we really want to take that away from those dogs? But at the same time, we're weighing that against, essentially, in my mind, these are lives lost in a horrible way. They did not need to progress this way. And they've gotten to a point where there are no good options. There are no more good options. There's no more managing the pain that they're experiencing. And so that's a really tricky scale to balance on. So yeah, I don't know. What is the right response on this? What is the right the right direction to take into the future? Yeah.
I mean, the only guaranteed way of not causing side effects is to not give it.
To not use it. Yeah. So are owners appropriately educated, Andy, in your experiences? The owners that come to you and they have these side effects, did they know that they were a risk to begin with when they started with this drug? Because that to me is a huge issue. These owners are doing the best thing that they can on the advice of their veterinarian, and they have no idea of the risks that they're running. They don't know that they're supposed to be pushing for screening. They don't know that they're supposed to be monitoring for these things because they think that this is safe. There's no risk involved. That's very much been my perception of the owner understanding and owner education. I think that is something we can do something about. I think every owner that is opting into this treatment should be well aware of the potential risks that they're facing.
And maybe they should be signing written consent to use it,
Yeah. Okay.
But yeah, it's difficult because the first question the owners asked you is, what are the chances? I can't tell you that. In my experience, it's very, very high, but I've got a skewed population that I'm seeing. But the true incidence, we don't know. So it is a bit like playing Russian roulette, but you don't know how many bullets are in the gun, and it might be fully loaded.
How do we solve that problem? How do we actually get non-skewed statistics on the incidence of adverse events? Does Zoetis hold that information? Because adverse events are reported to them, and they also know how much of the drug is being used. Do they hold that information? How do we get an unskewed, idea of the actual prevalence?
I mean, all of that information is passed on to the VMD in this country and the FDA in the USA. Like, that is a legal requirement that any adverse event that's reported to Zoetis must be reported within 28 days to the VMD. So, I mean, I've been in discussions with the VMD and Zoetis, and I've looked at their reporting systems, and they could be better, but that is, that's not the drug company's fault. That's just the system that's being used. And I think it's important that as much information is given as possible. So actually phoning Zoetis or the VMD to give that information and give as much information as possible when you are seeing a potential adverse event, and that includes lack of efficacy. So if it's was working and is now not, or didn't work from the get-go, that that should be reported for sure. And only until these cases can be reported, investigated, and certainly, the VMD has just last week updated their recommendations and they have recommended that appropriate diagnostic imaging is done prior to administration to confirm the diagnosis, and then serial radiographs to monitor. But then that goes back to the primary care vets that then have got to speak to the owners and say, hang on a minute, we need to sedate your dog again. We need to take x-rays at your expense to, monitor for any problems on this drug. And that's difficult. That's a difficult conversation. And, a lot of people aren't going to be able to afford to do that.
Yep. Yeah, and that to me is really part of the decision making that needs to happen for an owner. They need to take that into consideration. If we use this drug, then the best thing to do is that we are having x-rays at least every 6 months. That's a lot of x-rays to commit to. For the rest of my life, this is what we're doing. They should be seeing a rehabilitation therapist regularly so that we can monitor strength, neurological function, and joint health throughout the body, because we can see and feel those changes. Like you said, you can feel those changes within the joint, and you'll be able to feel that, especially if the dog is not showing signs of pain. We can pick that up on a manual assessment. That should be part of the like the decision making process. But it definitely feels like this is given, like many other drugs. If we're giving this and the pain is under control, then we don't need to worry about the rest of the things. We don't need to worry about regular rehabilitation or physiotherapy, because that's an additional cost and it's additional thing to manage. So I think I think from my perspective, I think that really that's the area where we can make a difference right now is in owner education and having them truly understand from our perspective what could go wrong and what can we do to prevent that. And the decision to use the drug or not use the drug should be theirs, but they should do that with as much knowledge as we can give them.
And support. And I think, physical therapists are in a fantastic position to monitor for change. And if you know what to look out for, it's very easy to spot that, things are not going according to plan. And then, you can flag that with the veterinary surgeon to prompt further investigation.
Okay, Dr. Andy, thank you so much for this conversation today. It's been a really good one. We've had amazing comments. I know that we didn't address all of them, guys, but thank you for joining the conversation. It's been really good to have you here. Thank you.
Thank you.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free. So go and check them out at pawprosper.com. And also don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.